Hi, my name's Leana Detweiler, and I did my presentation on strokes. So what is a stroke? A stroke occurs as a result of a blocked blood vessel or bleeding in the brain. There are three different types. There's ischemic, hemorrhagic, and transient ischemic attacks. So an ischemic stroke is caused by an obstruction or clot in the blood vessel supplying blood to the brain. It's the most common type of stroke, accounting for about 87% of all strokes. A hemorrhagic stroke occurs when a weakened blood vessel ruptures and spills blood into the brain tissue. There's two different types of weakened blood vessels that will cause a hemorrhagic stroke. The first being an aneurysm, which is a ballooning of a weakened region of a blood vessel, and if left untreated, it will continue to weaken until it ruptures and it'll bleed into the brain. Arteriovenous malformation is another one. It is a group of abnormally formed blood vessels, and a rupture of just one of these blood vessels will lead to bleeding in the brain. Hemorrhagic strokes are most commonly caused by uncontrolled hypertension. And then lastly, a transient ischemic attack is often referred to as a mini stroke. It occurs when an artery supplying oxygen-rich blood to the brain becomes blocked. Most often, temporary clots are the cause of these blockages. So every stroke is unique, however, they all tend to have the same effects on people. It just depends on the location of the obstruction and how much brain tissue is actually affected. So, for example, if a stroke occurs in the brainstem, depending on the severity, it can cause both sides of the body to be affected, and it may put someone in a locked-in state when the patient is unable to speak or produce any movement below their neck. A left brain stroke will affect the right side of the body, and it could produce any of the following: paralysis on the right side of the body, speech and language problems, slow, cautious behavioral style, or memory loss. And then a right brain stroke will affect the left side of your body, producing any of the following: paralysis on the left side of the body, vision problems, quick inquisitive behavioral style, and memory loss. So what are the warning signs? What do you need to look out for to determine if you or someone else is having a stroke? So you'd want to use the acronym FAST, that stands for facial drooping, arm weakness, speech difficulty, and time to call 911. So there's a couple tests that can be performed in order to determine if someone's having a stroke. For facial drooping, ask the person to smile and look for any deviation or lopsidedness in their face. To test arm weakness, ask the person to reach their arm straight out in front of them and look to see if one arm slowly drifts downward. To test speech difficulty, ask the person to repeat a simple sentence back to you, and you want to make sure that they're saying it clearly and correctly back to you. And lastly, if the person is displaying any or all of these signs, you want to call 911. It's important to do this immediately as time is of the essence, and it's also important that you note when the first signs started to appear, because the emergency medical professionals will want to know that information. So I'm going to show you a little clip that just goes a little bit more into detail about the effects and some signs of the stroke.
Stroke is the most common cause of disability in the world. More children die of stroke than die of pediatric leukemia. More women die of stroke than die of breast cancer. It's the fourth leading cause of death overall in the United States. It's a fundamental, critical, important problem causing disability and death. Some of the more subtle indications of stroke that are sometimes missed is when you're numb on one side, or you lose the ability to pronounce words, or you lose the ability to walk a straight line. You've got a certain part of your brain that controls your speech, a certain part of your brain that controls your vision. If I cause a stroke, there's dysfunction because I've killed part of the brain. One of the most common causes of symptoms in a patient, a young person that isn't a stroke, is migraine. Migraine can mimic a stroke. Migraine simply changes the blood flow. It changes the way that part of the brain works temporarily, and it can change back when the migraine is over. But during the migraine attack, the symptoms look the same. Migraine lasts until you stop it, and if you don't stop it, it can turn into a stroke. If you or someone you're with suffers the sudden onset of numbness on one side, or slurred speech, or inability to walk a straight line, something that could be a stroke, it's time to call 911.
So next we'll talk about treatments. So fortunately for stroke patients, there are several different types of treatments that can be done. It just depends on the type of stroke that has occurred. So for an ischemic stroke, they often use clot busting or clot dissolving medication called tissue plasminogen activator, or TPA. It gets injected into the patient's arm up to 4 hours after the first signs appear. And then if TPA cannot be given, antiplatelet medicine is given to prevent future blood clots, or a blood thinner is given to keep existing blood clots from getting larger. For hemorrhagic stroke, you do not want to use antiplatelet medicine or blood thinners because this will just worsen the bleeding. Instead, if the cause of the stroke was high blood pressure, they will give you medicine to lower your blood pressure. Surgeries are also a common form of treatment, some of the most popular being aneurysm clipping, coil embolization, and arteriovenous malformation repair. For my case study, my patient is a 67-year-old male who recently suffered a stroke 2 days prior. He is 6'1" and weighs 185 pounds. The patient was independent and driving prior to having the stroke. He presents with left facial drooping, cognitive impairments such as memory loss, and the left side of his body is significantly weaker. He was active for at least 30 minutes 3 days a week at a light to moderate intensity level, doing activities such as golf, swimming, and walking around the park. The patient does not smoke and has no family history of heart conditions or attacks. His LDL level is 140, his HDL level is 80, fasting blood glucose is 95, his blood pressure is 144/96, and his BMI is 26. So as for his risk stratification, his LDL is above 130, which is a positive risk factor. His HDL is above 60, which is a negative risk factor. His fasting blood glucose is below 100, so it is not a positive risk factor. His blood pressure is above 140/90, so it's a positive risk factor. His BMI is below 30, so it is not a positive risk factor. His age is greater than 45, so that's a positive risk factor. He's a non-smoker. This is not a positive risk factor. And he has no family history of heart disease or heart attack. This is also not a positive risk factor. So in total, he has a risk score of about 2+. So there's a couple different tests that can be done on stroke patients. One being a manual muscle test, which is when each muscle group is tested bilaterally. The examiner will demonstrate a movement against gravity and then ask the patient to repeat that. If they are successful, the examiner will then add resistance, using one arm to stabilize and one arm to add resistance. And then the goal for this test is just to see where weakness is in the body or extremities. Next is the Montreal Cognitive Assessment, otherwise known as the MoCA. This is more for the cognitive side of strokes, so it's a rapid screening tool to assess cognitive dysfunction. It's a really great test to use because it covers a lot of different areas such as attention and concentration, executive functions, memory, language, visio-constructual skills, conceptual skills, calculations, and orientation. Depending on how the person performs, it specifies the area of impairment and what needs to be worked on. So for exercise prescription, stroke patients have to go through a lot of barriers in order to exercise, such as lack of support, motivation, the severity of the stroke, and fatigue and depression. But it is very important that stroke patients get up and moving as soon as they can after the stroke has occurred, because recovery has been shown to be greatest within the first 6 months. So for aerobic exercise, I would have my client doing exercise at least 3 days a week at a 40 to 70% intensity level, doing light to moderate activity. I would start him at 10 minutes, gradually working up to 30, and doing activities such as walking, swimming, or household tasks such as vacuuming or washing dishes. Swimming is a great exercise to do because it reduces the stress on your body, and it also allows the person to challenge themselves because the risk of injury is decreased by being in the water. It's important to also note that some patients may do better with exercise broken into 10 to 15 minute increments, just depending on their the stroke severity that they went through. For resistance training, I would have my client do this 2 to 3 days a week at 60 to 80% of his 1 RM, 8 to 12 reps for 2 to 4 sets. I'd begin with resistance bands and machines in order to regain his balance and strength before moving on to free weights just to reduce the risk of injury. Also, strength training is very important because it is shown to be vital for restoring a person's walking efficiency. And for flexibility and balance, I would have my client do this at least 3 days a week. The intensity is just reaching mild discomfort. Hold the stretch for about 10 seconds. And I would have my client do activities such as yoga, tai chi, walking heel to toe around their home. Also a great exercise is to sit on a bench and just move side to side, practicing weight-bearing activities for your balance. A couple things to keep in mind. Rehabilitation during the first 6 months post-stroke is when most recovery occurs. Exercise reduces disability and risk of recurrent strokes. You want to limit the bed rest in the immediate days after a stroke. Customize the exercise prescription based on your patient. Utilize rehabilitation programs, and the ultimate goal of rehab is to regain a person's independence. So what really happens during rehab? The services provided usually just depend on the patient's individual needs. However, in general, it's just to improve their independence and quality of life. They focus on mobility skills, self-care skills, communication skills, cognitive skills, and social skills. In conclusion, some important things to know and some important statistics are strokes are the #1 cause of long-term disability in the United States. About 795,000 people suffer a stroke each year. Approximately 3/4 of all strokes occur in people over the age of 65. 3 out of 4 people who suffer a stroke have high blood pressure. Strokes are very treatable, and the faster discovered, the better chance of recovery. Risk of stroke increases with age, but it can occur as early as infancy. Strokes are a disease of the brain, but they can affect the entire body. And symptoms can be detected using the acronym FAST. Here are my references. Thank you.